हाय हेलो एवरीवन, हेलो दोस्तों, आप सबको मेरा प्रणाम। Am I audible and visible? Yes guys, audio video is clear. Yes, medico Ipsita Roy, good evening. So good evening, welcome to Forensic Medicine and Toxicology Sushruta Branch 2025. So today we are going to discuss about orientation to forensic medicine and also few definition and few important aspects of forensic medicine. Yes, Ipshita Roy, medico, fine, okay. Hello. Yes, good evening all, good evening all. So that's great. Mohit Singh, Harshita, how are you? Mohit Singh, how are you? How is the preparation? How is your third year going on? Chalo. So let's make it this as an interactive session. You can interact with me. If you have any doubt, you can ask me in the chat box. And we'll have a few MCQ based questions as well today. Okay, just started. Okay, Ames 131. Good evening. Rohit Nagle, good evening. Vivek Jangu. Okay, good evening all. Okay, let's start. So let's start. To begin with, the corpse is a silent witness that never lies. लाश एक मूक गवाह है जो कभी झूठ नहीं बोलती. How many of you agree with this? How many of you agree with this statement? Yes, guys. Good evening, Snehajit. Good evening. How many of you agree with this? Dead body that speaks about the injury, that speaks about the manner of death, the cause of death, and also that will give you a lot of clues to find out the nature and also the cause of death. Yes, Umesh and all. How many of you agree with this statement? Say yes or no. Agree or disagree? 100% agree. Yes, Snehajit, very good. Yes. So let's start now. So in this session, so we are going to discuss about a few important university questions. So basically, what is forensic medicine? A 3-mark question. Medical jurisprudence, very commonly asked 3-mark question. Or sometime it is very commonly asked 5-mark question as well. Then BNS, Bharatiya Nyaya Samhita, BNSS, Bharatiya Nagarika Suraksha Samhita, and BSA, Bharatiya Suraksha Adhiniyama. Very commonly asked 3-mark question. Then inquest, very important topic, very commonly asked as a 5-mark question and very commonly asked in INICET, NEET PG exam, most of the exams. So at the end, we will have discussion about INICET question, previous year questions, and NEET PG questions. Okay. Chalo. Now let's start. So what is forensic medicine? What is forensic medicine? You must have seen CID. You must have seen Crime Patrol, Southern India in TV, right? So one word answer. Can anyone tell me one word answer for forensic medicine? What is forensic medicine? Forensic medicine क्या होती है? One word answer. Yes, Rishak. One word answer, guys. I need only one word answer, okay? See, the word forensic, it has come from a Latin word forensis. The forensis means forum. The actual meaning of forensic word is forum, very commonly asked. Okay, forensic medicine from a Latin word forensis. The meaning of this is forum. So commonly asked MCQ, forum. So old days, the ancient days in Italy, Rome, they used to solve all criminal matters, civil matters in a public place. That is nothing but forum. That is nothing but marketplace. Okay, yes, good. Nehajit. Okay. Okay, Ipshita, investigation. Very good, Ipshita, good, investigation, one word. So all of you write in the chat box, forensic is equal to forum in the chat box. Forensic is equal to forum because it is MCQ. Actual meaning of forensic is forum. Write this in chat box. So keep writing. So interact with me. You can keep me awake and you can keep yourself awake. Okay. So it will be more of interactive class, two-way communication. Yes. Rishak Dusane. Okay. So what is forensic medicine? If they ask you in theory exam, what is forensic medicine? Your answer must be, it is a branch of medical science which deals with application of medical knowledge. Application of medical knowledge in administration of justice. In administration of justice. This is very commonly asked question in Viva. So your answer must be like this. Administration of medical knowledge, that is application of medical knowledge in administration of justice. Like example, hanging. Like example, hanging. See, hanging can be suicidal, Pasi can be suicidal, it can be homicidal, or it can be accidental as well. So, by using our medical knowledge, we can tell about the manner of death. Also, the cause of death. So, what is the cause of death in hanging? Asphyxia. So, one example, asphyxia. One more example, burn injury. What is the cause of death in burn injury? The cause of death in burn injury, the most commonly, it is septic shock. Septic shock. So usually after 3 days after the burn injury, the cause of death is septic shock because of gram-negative bacteria. One more example, drowning. Drowning. So can anyone tell me what is the cause of death in drowning? Come on, come on. Try Shivangi. Try Shivangi, Snehajit, Alladitta, Ipshita Roy. You just try. What is the cause of death in drowning? Drowning in a water, sea water, fresh water. What is the cause of death? Let's see who is going to answer. I'm just waiting for your answer. Come on, guys. Okay. So the answer is again asphyxia. The answer is asphyxia. So I'll repeat again. Application of medical knowledge in administration of justice known as forensic medicine. Like example, in hanging, asphyxia is the cause of death. Burn injury, septic shock. Drowning, it is asphyxia. Again, the manner can be suicidal, homicidal, and accidental. So this is what very commonly asked in the exam. Now say example, one more example. So this is cricket bat. Okay, cricket bat. Now all of you, can anyone tell me what are the injuries caused by this cricket bat like this? Like this. Yes, come on guys. What are injuries caused by blunt force? Yes. So your answer must be abrasion, the bruise and laceration, right? Good. So blunt force, what are blunt force injuries? Abrasion, bruise and laceration. So this is one example. So one more example. Now look at this. Here is a single-edged knife. Okay. What are injuries caused by this sharp weapon? Let's see who is going to answer. Chalo, let's answer. Okay, Rohit, very good, Rohit. So the answer is sharp force, incise wound, and stab wound. Incise wound and stab wound. So this is how you should elaborate the answer in your university exam. Okay, I hope you understood the definition of forensic medicine. Now we have some more definition. What is medical jurisprudence? Juris means law. Prudence means knowledge. So juris means law. Prudence means knowledge. So the medical jurisprudence is application of legal knowledge in clinical practice. All of you try to understand there is a difference between forensic medicine and medical jurisprudence. Both are different. Forensic medicine is application of medical knowledge in administration of justice. Medical jurisprudence is application of legal knowledge in medical practice. So in medical practice. So commonly asked, like example, consent, medical negligence, all this comes under medical jurisprudence, not the forensic medicine. Forensic medicine. Okay, good, Rohit, that's great. Okay, single icon. So in between we will use Hindi as well. So आप ध्यान से सुनिए, कोई दिक्कत नहीं है. So just try to understand. I'll use simple language, simple English language. Don't worry about it. Then medical etiquette. So matlab medical etiquette means it is the study of conventional laws of courtesy between the two doctors. So medical etiquette is laws of courtesy. Between members of medical practice. So that is medical etiquette. What is medical ethics? That is study of moral principle. Study of moral principle. Morality. Ethics means morality. Study of moral principle. Then one more one-liner commonly asked, when is forensic day? Your answer must be May 12th. Who is the father of forensic medicine? Palogachia. Palogachia. So all these are one-liners, very commonly asked in university exam as well as INICET and NEET PG exam. So very commonly asked. Okay, now let's have some example. Now look at this. This is the crime scene. So in crime scene, so what we got? 5 skeleton and suspected case of sleeping pill poisoning or suicidal poisoning. My question is it forensic medicine or medical jurisprudence or medical etiquette or medical ethics? One word answer. So this is a case that happened in Chitradurga, that is in Karnataka. 5 dead bodies were found in a remote place, in a remote house, and dead body were belonging to some age, so 2019 or before that. So all skeleton were found. So my question here is to find out the cause of death, to find out the manner of death. What is this basically? Is it forensic medicine or medical jurisprudence? Yes, come on guys, single icon. Single icon, Snehajit, Rohit, Umesh, very good. So this is what forensic medicine. Very good, forensic medicine. Now one more example. Now look at this. Newspaper headline. Newspaper headline. 2 doctors suspended in alleged case of medical negligence causing amputation of child hand in Kerala. So this is application of legal knowledge in clinical practice. Again the same question. Forensic medicine, medical jurisprudence, medical ethics, medical etiquette. Again all of you guys. So Harshita and others, try this. So medical negligence, consent, so all this legal knowledge applicable to medical practice, what is that known as? Good answer. So this is basically jurisprudence. So medical jurisprudence. Chal. Now one more example here. Again a case of medical negligence. Doctors accidentally amputate wrong leg. So the patient was suffering from some injury on the right leg. The operation was done on the left leg. So elderly patient in a tragic mistake. My question again, is it forensic medicine or medical jurisprudence? Try again. Umesh, Saini, try, all of you, try this. All these are newspaper headlines taken from recent newspapers. Okay, so one more example. Now, and you must be knowing very famous movie Arjun Reddy. Alcoholic surgeon doing surgery under the influence of intoxication, leading to death of the patient. That means it is against moral principle. So it is against moral principle. We call it as infamous conduct. Or professional misconduct. Now again the same question. Forensic medicine, medical jurisprudence, medical etiquette, and medical ethics. Yes, good. So answer is, it is medical ethics. Now one more example. So look at this, a doctor, and here is also one more doctor. Okay, disrespecting the colleague or the medical professional or conventional loss of courtesy between members of medical profession. What is this known as? The last question. Yes, come on guys. Snehajit, very good Snehajit. So this is basically medical etiquette. So good answer. So this is what very commonly asked question. I hope you understood. If you have any doubt, you can ask me. Umesh, have you understood all the definitions? Umesh, Rohit, Ipshita, Harshita, Snehajit Chaudhary. Okay, so yes, fine. That's great. Now some more questions. Now let's see some previous year questions asked in your NEET PG and INICET exam. So let's make it interactive. Try to answer. So this is one question asked. Who performed the first medico-legal autopsy in India? Options are Dr. Edward Buckley, Paulo Jaccia, Bartholomew, JP Modi. So asked in your exam. Snehajit, Rohit, you just try. You can make 100 of mistakes in my class. So let's make it interactive. You can learn from the mistake. Okay. So Harshita, yes. Okay, Palojachia is a father of forensic medicine. Father of FM. And he is not from India. He is not from India. And this is not the correct answer. Bartholomew, the first autopsy in the world conducted by Bartholomew. Not the answer. JP Modi, father of forensic medicine in India. So the answer is Dr. Edward Buckley in Chennai. In Chennai. The first case was about arsenic poison. Arsenic poison. So arsenic poison, known as king of all poison. It's ideal homicidal agent. So that we will discuss in toxicology, don't worry. So answer is Edward Buckley. So good, single icon, very good. So the answer given by single icon, no, answer given by Sneha. Very good, Sneha. Sneha, excellent answer. Excellent answer. Good. The next question. Forensic Medicine Day celebrated in India. There are 4 options are there. Can you answer now? So answer is May 12th. So my birthday on May 7th and May 12th is the Forensic Day in India. Okay. Yes, good. Rohit, good answer. Good. Chalo. This is okay. Then third question. Third question, again, it is asked in one of the entrance exam. The concept of every contact leaves a trace. Like example, case of rape. In case of rape, so there can be some trace evidence like semen, blood stain and all. So every contact leaves a trace. So this is known as exchange principle, law of exchange principle, given by Alfred Jeffrey, Carl Mullis, William Herschel, Edmund Locard. Edmund Locard. Yes, very good, Prasanna, excellent answer. So the answer is Edmund Locard. Okay, so Alfred Jeffrey, DNA fingerprinting. So he's the father of DNA fingerprinting. So you must know all the options and you need to rule out the answer, rule out the options as well. Carl Mullis, he explained PCR, polymerase chain reaction. William Herschel, fingerprint. Fingerprint. You know, there are 4 types of fingerprint: loop, arch, oval, composite and all. So that is what given by William Herschel. So the best answer is Edmund Locard. So the answer given by, yes, the first, okay, the answer given by Prasanna. Very good, Prasanna. Good, good. Chalo. Now next. The father of forensic medicine and author of questions medico-legalis, again asked in INICET exam, NEET PG exam and your university exam as MCQ. So father of forensic medicine. The father of toxicology, Matthew Orfila. The father of public health, cholera. Cholera. So the answer is Palojachia. So B is the answer. B is the answer. Yes. So the answer given by Rohit. Very good, Rohit. Next. Literal meaning of word forensic. So we discussed in today's class. So options are forum, pulselessness, the fact speaks for themselves, crime. Chalo, let's see who is going to answer this. Ayush Banerjee. Okay, good answer, Harshita. The first answer is Harshita. Very good, Harshita. So the answer is forum. A. Now try to remember. Pulselessness is a meaning of asphyxia. Asked in university exam. What is the meaning of asphyxia? That is basically pulselessness. Then facts speaks for themselves. That is nothing but res ipsa loquitur. Res ipsa loquitur. Again, we are going to discuss about all this in upcoming classes. So time being, try to memorize. Res ipsa loquitur in forensic medicine is nothing but the facts speaks for themselves. Then crime, so that is not the answer. So the best answer is forum. Good. So cholera is very interesting. The cholera is the father of public health. Okay, not the father of, it's not the name of the person. Okay, it's a disease. Now, very simple question. Tell all of you. Application of medical knowledge in aiding justice. Medical knowledge. So when word medical knowledge, your answer must be forensic medicine. Very simple. Forensic medicine. Okay. Good. Now, question number 7. Application of legal knowledge in clinical practice. So whenever word legal knowledge, medical jurisprudence. So no doubt in this. Then one more question. Which of the following deals with moral principle? Moral principle. Like having alcohol and treating the patient without the consent, and revealing the secrets of the patient, and all this basically against the moral principles. So that is basically medical ethics. Medical ethics. So good. C is the answer. Many answered correctly. Soumyadeep. Good. Soumyadeep, correct answer. Chal. Then forensic medicine also known as state medicine, Karnataka state, Delhi state, Rajasthan state, legal medicine, medical aspects of the law, all the above. All the above. Try this. Again, repeat question in your INICET exam. So very good, medico answered correctly. All the above. All the above. So name given to forensic medicine, all the three. Then the last question. Bit difficult one. You try to answer. Try to answer. Forensic medicine divided into forensic pathology. So we broadly divide forensic medicine into forensic pathology. So that is pathology means in dead person. So whenever word pathology, dead person. And clinical forensic medicine. So clinical means that is living patient, living person. Like example, age certificate, like example, birth certificate, all this in living person. So following are included in clinical forensic medicine, except is there. The word except is there. Options are wound certificate, age estimation, potency certificate, postmortem certificate. A bit tricky one, you can just try. So wound certificate given in living person. So in case of dead person, we give postmortem certificate. Age estimation, living person. Age estimation basically a component of living person examination, not the dead person. Potency certificate, again living. Living. Postmortem, basically dead. So the postmortem and all that comes under the forensic pathology. So the answer is D is the answer. So all these are repeatedly asked. Now let's see what is your score. So all of you now, you just tell me your score out of 10. Out of 10. Anything more than 10, definitely good. Very good. Anything more than 5 out of 10, definitely good. Yes, Harshita, Umesh. Jaldi batao, jaldi batao. What is your score? You answered 10 questions. No. Out of 10, what is your score? So Harshita got 8. Good, good. Ames 135. Snehajit. So all qualified. Excellent. Congratulations. Great. Great answer. More than 5. Rohit. Ames 131. So that's great. So now this completes your definition. Now let's start about legal procedure. So in legal procedure, so one very commonly asked question is inquest. What is inquest? What are types of inquest? Very commonly asked 5 marks question. Five marks question, commonly asked 3 marks question, university question as well as MCQ as well. Good. Inquest means in general inquiry towards cause of death. So in simple word, it is kanuni janch, inquiry or investigation towards the cause of death. So in simple word, inquest is inquiry towards cause of death. Cause of death. Say example, मौत की और मौत का कारण, मृत्यु का कारण. Like example in case of hanging, asphyxia is the cause of death. Drowning, asphyxia. Burn injury, septic shock. OP poison, respiratory paralysis. Snake bite, respiratory paralysis or hemotoxicity. So that is basically cause of death. Or mrityu ka tarika, that means basically the manner of death. Manner of death. Sometime to find out the identity, pehchan, that is the identification of dead body, and to identify. Lastly, sometime, not in all the cases, in some cases, to find out the place of crime. So that is place of crime. So whenever question asked in exam, this should be your answer. Sir, inquest means inquiry towards cause of death, sometime manner of death, sometime place of crime, sometime identification of dead body. Like one example, can anyone tell me what is the manner of death in autoerotic hanging? So very interesting condition, autoerotic hanging. The death occurs during masturbation due to asphyxia. We call it as sexual hanging. We call it as autoerotic hanging. My question is, what is the manner of death in autoerotic hanging? Manner of death, suicide or murder, or it is accidental death. Accidental death. Try. So yes, unnatural death basically. So inquest is done in case of unnatural death. Any unnatural death, including medical negligence, road traffic accident, suicide, murder, culpable homicide, fall from height, any unnatural death, poisoning, snake bite. So it is done, inquest is done. So very good. I think first to answer is by Harshita. Harshita answered, sir, autoerotic hanging, usually accidental death. Accidental death. So this autoerotic hanging, sexual hanging, we are going to discuss in detail in asphyxial death classes. Okay. So yes, now hello. Now I have one more question for you. Now look at this. So this is knife, and there is one method of death in Japanese. So suicidal stab injury like this. Suicidal stab injury from left to right. What is this known as? So in Japanese, it is also known as seppuku. They will do some stab wound over the abdomen from left to right. That leads to cardiovascular collapse and death. So it is a suicidal stab wound. What is the name given to that? Can you answer this? Can you answer? Suicidal stab wound. The question is suicidal stab wound. So answer must be harakiri. Harakiri. So all of you write in the chat box. Suicidal stab is equal to, or stab is equal to harakiri. Just write the word harakiri. Just write the word harakiri in the chat box. So you can keep yourself awake. You can keep me also awake. Yes, come on guys. Just type the word harakiri. Harakiri. Kiri kiri. Harakiri. So many. Yes. Try. Try. Okay. Good. Harakiri. Now I have one more question for you. Now look at this. So I got this skull in the crime scene. Okay, again unnatural death. Unnatural death. We call it as exhumation. So while examination, my findings are steeper forehead, rectangular orbit, bony markings are very prominent. My question is it male or female? Male or female? Identity basically. So inquest I said identity. So what is the identity of this skull? Steeper forehead, rectangular orbit, bony markings are prominent, frontal parietal eminence are not prominent. Now all of you, what is the answer for this? Yes, tell me. Try guys. Male, very good. Male. Nehajit, excellent. Umesh, Epshita, Rohit, Swamirip, very good. Male. So steeper forehead is seen in case of male. Good. So inquest means it is an inquiry towards cause of death, or manner of death, or identity, or place of crime. So I hope you understood. Inquest. Yes or no? Try. Yes, you can identify the age also. So that we will discuss in upcoming classes. In identification classes. There is a chapter known as identification. In that we are going to discuss all the bones, skull bone and related all the bones. Just a sample today. So picture abhi baki hai. So we will discuss in upcoming Sushruta 3.0 classes. Okay. So chalo. Okay, all of you guys, ठीक है? चलो. Now what are the indications for inquest? So there are many indications. In one word, unnatural death. So inquest is done in unnatural death. Like example, sudden death in unnatural condition. Any case of sudden death in unnatural condition. If it is natural, inquest is not required. When suspected some crime, some suspicion is there, then you can do the inquest. Suicide, any case of suicide. The commonest method of suicide in India, hanging. Homicide, like example, gunshot injury, firearm injury, stab injury, smothering. Infanticide, especially in case of female feticide, infanticide. Accidental death, road traffic accident, any accidental death, inquest is done. Anesthetic overdosage, inquest is done. Medical negligence, custodial death, death in police custody, death in jail, death in psychiatric hospital, dowry death. In all these conditions, inquest is done. Any unnatural case, inquest or investigation towards the cause of death is done. Okay, yes. Chalo. Now let's have what are types of inquest and some interesting MCQ as well. Types of inquest. So this is again 3 marks question. There are 5 types: police inquest, magistrate, medical examiner, coroner, procurator, fiscal, system. So there are 5 types. Police inquest. It is the most common inquest in India. Most common inquest. Here, investigation conducted by police officer, usually sub-inspector. So usually sub-inspector. Or in some states, ASI also, assistant sub-inspector. Again, this is asked in your exam. Police inquest is conducted by police officer, usually by sub-inspector or above the level of sub-inspector like DYSP, inspector and all. Not the police constable, not the dafedar, basically sub-inspector. It comes under 194 BNSS. So all of you concentrate. Police inquest, how to conduct police inquest. All this comes under a section of Bharatiya Nagarika Suraksha Samhita, that is 194 BNSS. Again, this is a fact based. There are few things in forensic medicine which are totally fact based. You have to memorize, you need to mug it up. So all of you write in the chat box, police is equal to 194 BNSS. BNSS. Yes, drug abuse also unnatural death. Unnatural death. See, Sarita Podar, IPC and BNS both are same. IPC, that is outdated. BNS is updated. In present, BNS, that is running. Outdated, that was basically IPC, Indian Penal Code. So, yes. So all of you write, Soumyadeep, Snehajit, police is equal to what? 194 BNSS. Bharatiya Nagarika Suraksha Samhita. It's a fact basically. So what happens any case of unnatural death, like example skeleton, like example suicide, hanging, drowning, fall from height, drug abuse. In any case, police sub-inspector, he will go to the crime scene. So he will go to the crime scene. Crime scene. So he will talk to the neighbors, he will talk to the witness, and he will prepare inquest reports. So what he will do? He will prepare inquest reports. Inquest reports as per 194 BNSS. So that is known as Panchaname or Panchanama. Again, commonly asked. Panchanama. Panchaname. That means Pancha means 5. So that is the witness or the statement from the 5 people surrounding that area. So Panchaname. And before that, he will inform the magistrate also. So before that, he will inform the magistrate. Then he will prepare Panchanama. Then he will send the dead body to the forensic department, FMT department, and he will request for autopsy. So as a forensic expert, I must find out what is the cause of death. In some cases, manner of death, some cases, place of crime, as well as identity also. So that is autopsy. So once autopsy is done, so he will prepare further sections. In the beginning, he will put FIR, then he will place charge sheet. He will prepare charge sheet. Then he will submit this charge sheet to court. So what happens in the court? In the court, there will be trial. Okay, in the court, there will be trial. I'll repeat again. So police inquest conducted by police officer, usually sub-inspector. He will inform the nearby magistrate. Then he will visit the crime scene. He will prepare inquest reports as per 194 BNSS. Then he will do Panchanama. Then along with the Panchanama and dead body, he will visit the forensic department, that is for the autopsy. So once autopsy is over, he will prepare charge sheet. He will submit to the court. In the court, there will be trial. You know, there will be arguments between the defense side and prosecution side. So there will be judgment like that. So this is how it goes actually. Okay, now my question is, all of you guys, which is best inquest in India? Is it police inquest or magistrate inquest? Now look at this image. I have two images here. So one is the police sub-inspector, police inquest, and the second one we have magistrate. That means Tahsildar, AC or DC. My question, which is the best inquest in India? Is it police inquest or magistrate inquest? Just try, come on. Come on guys. Panchanama means inquest report, beta. Inquest report. Written statement from the witness. 5 witness. Which is best inquest? Snehajit. So police means sub-inspector. Magistrate means magistrate, either Tahsildar, AC or sometime DC, usually AC or Tahsildar. My question, which is best inquest? Yes, very good. So answer is magistrate inquest. So magistrate is the best inquest. Okay. So in India, best inquest is magistrate. The most common one is police inquest. Both are very important MCQ. Try to understand. Okay. So now come back to the types of inquest. So this is about police inquest. So police inquest is inferior to magistrate inquest. MCQ. Now magistrate inquest. What are the indications? So indications are, one is dowry death. Dowry death. Death of wife within 7 years of marriage. When she dies in unnatural condition, it is presumed as a dowry death as per 80 BNS. 80 BNS. So one common indication is dowry death. The second common indication is exhumation. Matlab, digging out of the dead body from the grave. Exhumation. Then death in police custody. So death in custody. So 3 common indications of magistrate inquest. One is dowry death, custodial death, death in police custody, death in psychiatric hospital, death in jail, death in police firing. Then exhumation. So all these are indications. This is very commonly asked a 3 marks question. 3 marks question. Snehajit, basically, magistrate is more educated, uh, educated than police officer. So sub-inspector, so usually class 3 officers. Magistrate, they are basically class 2 and class 1 officers. So they are more educated. So that is the reason probably, and other reasons as well. You must be knowing that. Okay. So all of you write in the chat box. Magistrate inquest is equal to dowry death, and all of you write in the chat box. Dowry death is equal to 80 BNS. 80 BNS. Write this in chat box. Dowry death is equal to 80 BNS. So keep writing. So 1 time writing is equal to 10 time reading. Nehajit, Somirip, keep writing, guys. Yes, Ipshita Roy. Good. Okay. So in India, we have police and magistrate. So in India, we have only 2: police inquest, magistrate inquest. But in other countries, we have other types as well. One is medical examiner. So medical examiner in USA, in Japan, in Canada. So medical examiner, he is a dual expert. He is basically forensic pathologist. He is basically forensic pathologist. He is a dual expert. He is expert in forensic medicine. He is also expert in legal laws. He is a dual expert. So it was one of the best inquests in the world. If they ask you an exam, the best inquest in the world, your answer must be medical examiner. Who is medical examiner? Dual expert. Expert in legal medicine and expert in pathology as well. So prevalent in US and other countries. Then coroner. Coroner's inquest conducted by coroner. Corona means king. So it was there in India long time back in Mumbai and Kolkata up to 1999. So it was there up to 1999 or 1998 in Mumbai and Kolkata. Now it is abolished. So coroner, usually a doctor or advocate or first class judicial magistrate. So corona means king, appointed by the king, British king. Then procurator fiscal system. It is similar to medical examiner. It is prevalent in Scotland. So all these are very commonly asked MCQ. Once again, I'll repeat, guys. So there are 5 types of inquest. There are 2 types common in India: police and magistrate. Police, commonest, comes under 194. So magistrate, there are certain special indications like exhumation, dowry death, death in custody. Medical examiner, usually dual expert, best inquest in the world, prevalent in Canada, Japan and US. Coroners, basically corona king, it was there in India, in Kolkata and Mumbai, now it is not there. And lastly, procurator fiscal system, that is prevalent in Scotland. Yes, I hope you understood this. We can now. Yes. So whenever question asked in exam, especially third prop students, so ध्यान से सुनिए, and concentrate. आपको लिखना like this. So police inquest 194. Police inquest done in unnatural death. What unnatural death? Suicide, homicide, accidental death. Sub-inspector informs near executive magistrate. Okay. Then he will prepare Panchanama in presence of witness. Common witness, usually common witness. Witness also, again, 2 types of witness: common witness and expert witness. So basically here, common witness. Then he will request for the postmortem examination. Then he has a power to summon the person. So police officer can ask anyone to attend the police station to give some evidence about the case, about the offense, about the crime. So that is comes under 156 BNSS. So this is how you should write for 3 marks question. 3 marks or 5 marks. Yes, Umesh. So can you able to write like this in exam, like this flow chart? So you will get 3 out of 3 or 4 out of 5 if you write like this. Summary. Umesh, Hipshita. Okay. Now look at this. Now I'm in the crime scene now. Crime scene. A case of drowning. A case of drowning. So in drowning case, the hand is like this. The hand is like this with aquatic matter, with the plant like this. Okay. So patient will be like this, okay. In a case of drowning, my question is, what is this finding known as? Try all of you guys. Try, Umesh, Shiny. Come on, try guys. Let's make it interactive. एक crime scene है, आपको ऐसे एक finding मिलेगा with some aquatic matter, mud in the hand. A case of unnatural death. Police officer will ask you, sir, ये क्या finding है? Rigor mortis? ये rigor नहीं है. ये rigor mortis नहीं है. It is only in the hand. It is not there anywhere. And it is antemortem finding. I'm giving you clue. It's antemortem finding. Antemortem means the finding which occurs when person is alive. Rigor nahi hai. Try to save himself. Okay, good. What is that known as? What is that known as? Yes, very good. AB Singh. AB Singh, good answer. So this is known as cadaveric spasm. Cadaveric spasm. That means it is a case of accidental death. Or it can be anything. So manner basically depends on the circumstances. But we can say in 100%, sir, it is basically antemortem drowning. Antemortem drowning. So this is how you should answer. Good. Harsha, that's great. Okay. Good. Now there are 4 images are there. All of you try to identify what are these 4 conditions. So first condition, schizophrenic patient. So patient is suffering from schizophrenia and he will die in psychiatric hospital. So what is the type of inquest needed? The one. Okay, point number 1. What type of inquest is needed? Picture number 2, you can see exhumation. Exhumation. Dead body showing skeleton. Picture number 2. Picture number 3, you can see the rupees there. Dowry death. Dowry. Within 7 years of marriage. And last one, death during police firing. My question is, what is the type of inquest needed in these 4 conditions? Come on, guide. Come on. So medical examiner is there only in the US, not in India. We are in India. So what is the inquest that is required? Come on, try. Soumyadeep, very good. She answered, sir, all 4 conditions. So it is the magistrate inquest. Magistrate inquest. So it comes under 196 BNSS. 196 BNSS. So take home message, police inquest 194, magistrate inquest is 196 BNSS. Both are MCQ. Again, I'm telling you, in forensic medicine, there are certain facts. It is not like other subjects. It is basically a legal subject. Certain rules, certain section you must know. आपको याद रखना पड़ेगा. There is no other option. एक ही option है revision. पढ़ना पड़ेगा बस. ठीक है? All magistrate. Good. Snehajit. Yes, dowry is 80. That is BNS. That is basically crime. But here is magistrate investigation. That is 196 BNSS. So in other class, we'll have discussion about what is IPC, what is CRPC, and what is BNS, BNSS, BSA, and all. So time being, just remember, police is 194, magistrate 196, BNSS both. Okay, good. Soumya, good answer. Take home message. Chalo. Now look at this image. This is autopsy. Autopsy. Autopsy matlab शव परीक्षा, postmortem examination, thanatopsy, necropsy, everything. Autopsy is there. Autopsy conducted by a doctor. He is basically forensic pathologist, and is also having legal degree. So my question is, what type of inquest is this? What type of inquest? We call it as dual expert. Dual expert. Come on, try this. Very simple now, very simple. Dual expert. We are all forensic expert. We are not expert in LLB. We are just forensic expert. But he is basically forensic expert and legal expert. Okay. Good. Good, all of you. Good. That's great. So this is about the orientation about forensic medicine. This is how we conduct our classes regularly. If you have any doubt, you can ask me. Any doubt, you can ask me. So upcoming classes will be like this, all image based, MCQ based, interactive, okay, and fun based learning, totally fun based learning. So any suggestion from your side? Am I very fast? Am I very slow? Am I too boring? Any suggestion from your side? Acha, okay. Snehajit is telling, sir, what is cadaveric spasm? Okay. Okay. This will explain. Don't worry. See, cadaveric spasm is a antemortem contraction of skeletal muscle, especially particular muscle, usually the muscles of the upper limb or muscles of the lower limb. It is because of the last act of the victim. So when victim tries to escape, trying to escape from the death, so he will do some efforts. Like example here, so a case of drowning, he will try to hold some aquatic animals or some mud and all. So this is antemortem contraction, the contraction of muscle that occur during or before death. That is known as cadaveric spasm, known as cataleptic rigidity. That we will discuss in drowning. So it is antemortem. It is before death. Like example here. Say example, a case of firearm injury. So in case of firearm injury, you will see like this, something like this, or you will see hand like this. So this is cadaveric spasm. So contraction of muscle before death. So any book is okay. Any book from your college, and our notes is more than sufficient. So my suggestion, go through all my notes, PPT basically after the class, That is more than sufficient. So now I have one more question for you. Now I have a question here. There's a plant here, basically from toxicology. So just to give a orientation, how they are going to ask question in Viva. So they'll give you plant like this, like this. You can see here, a white color flower, which is used in criminal abortion. It's a very common plant used in artificial brews. Can I identify what is this plant? Yes, go on. What is this organic irritant, which consists of calotropin, calatoxin? Yes, very good. Akda. So this is basically calotropis plant. So this is calotropis. This is organic irritant. The active principle is calotropin, calatoxin, calactin. Medico-legal importance is basically abortion and artificial brews. So this is how the question can be asked in forensic viva as well as forensic spotters. Yes, this is calotropis. Some student answered correctly, calotropis. Good. Okay, guys. Yeah. Sometime, yeah, they can give you like this, or they can place in the table. They can ask you identify this plant, identify the seeds. Sometimes snakes also. They can give you the picture. They can ask you identify the snake as well. Yeah, Snehajit. Not exactly like this, but they can ask. So in Sushruta batch, you can ask me, Rajat MM. We are there in Sushruta batch. We can ask any doubt regarding the subject. So all of you guys, any suggestion? Is speed okay? Am I very fast or very slow? Snehajit, Epshita. So this will complete your first class. So orientation of forensic medicine and toxicology and the inquest. Okay, I hope you understood all the topics. Thank you all.